Welcome to our first episode of the Fourth Trimester podcast, where we explore evidence-based and interdisciplinary perspectives of the postpartum experience. I'm Faye. I'm a fourth-year kinesiology student at the University of Toronto.
And I'm Ariane. I'm also a fourth-year kinesiology student at the University of Toronto.
So today's episode focuses on the psychological and emotional perspectives of the postpartum period. And this is a time that's often portrayed as a joyful and magical experience, but for many women, it can be incredibly complex and overwhelming.
I definitely agree. And this episode is really important because the postpartum mental health really affects a significant numbers of women and mothers, but it's still so misunderstood. It's also minimized or even stigmatized. And so we're going to unpack the difference between baby blues, postpartum depression, anxiety, but also the postpartum psychosis, which also kind of helps us dive into the identity shifts, body image, and the social cultural pressures that exist for motherhood.
Yeah, so let's start off with something that many people have heard of, and it's the baby blues. Clinically, the baby blues are sometimes referred to as an adjustment reaction with depressed mood. They're extremely common, and they affect about 50 to 85% of women.
I definitely agree, and they do typically take between 3 to 5 days postpartum, but then they should normally resolve after within the 2 weeks after giving birth. Symptoms can be tearfulness, mood swings, irritability, and also emotional sensitivity.
Yeah, and it's important to emphasize that the baby blues are considered a normal adjustment in childbirth. Hormones shift dramatically, sleep is disrupted, and there's an intense identity transition occurring as well.
Especially in the case of first-time mothers. So we can look into research shows that the first-time mothers, they often experience more severe or intense baby blues, partly because of the transition that they experience into motherhood, and also the unrealistic expectations that either they give themselves or the social pressures might be giving themselves of the way they should perform.
Yeah, and then that contrasts with postpartum depression, or PPD as it's often referred to. PPD is a clinical depression that occurs within the first year of childbirth, and it significantly impacts daily functioning.
I think it's also much more common than we ourselves have realized, but also other people realize. The fact that it's 1 in 5 women experience postpartum mood disorders, particularly just depression, and also the World Health Organization, they report that approximately 19.8% of women develop depression after childbirth.
Yeah, and unlike baby blues, postpartum depression does not resolve within 2 weeks on its own. It persists and it affects functioning. Women feel hopeless, they feel disconnected, unable to enjoy their baby, and they also question their ability to even care for their baby.
I definitely agree, and let's dive into postpartum anxiety, something that is often really overlooked, I think. Sometimes it often gets a lot less attention compared to other the conditions or the disorders that come with postpartum pregnancy.
Yeah, and according to some research done by Poluski and colleagues, postpartum anxiety can be just as common as postpartum depression. It affects roughly 10 to 20% of women, but it receives a lot less clinical attention, and it doesn't have its own specific diagnosis.
I definitely agree with that, and the fact that the symptoms can be mostly intrusive thoughts, they can be racing thoughts, excessive worrying, especially about the baby safety, and then severe sleep disruption. Even when the baby is already sleeping, a lot of the sleep just it's really disruptive for mothers.
Yeah, and then what's fascinating from a neurobiological perspective is that postpartum anxiety and depression are not simply the same as depression in other stages of the lifespan. That study I referenced earlier as well explained that the postpartum brain undergoes significant changes, unique changes in the hormone levels and the brain plasticity as well.
I definitely see a great example with this would be the amygdala, which in this case will regulate emotional processing. It also shows different activation patterns in postpartum depression compared to general depression in the population. In non-postpartum depression, they found the amygdala is quite often very hyperactive. However, in postpartum depression, many studies do suggest that it may be underactivated when responding to emotional stimuli.
Yeah, and then that reinforces that postpartum is mental health disorders are biologically distinct. They're not just regular depression that's happening after birth. They're this own separate form.
I definitely agree with that. And I also think, like, now we'll dive into the postpartum psychosis. This is considered more like a medical emergency. It's a lot more severe. It's very much on the severe end of the spectrum when it comes to a postpartum psychosis. It's a very rare kind of condition. It only affects about 1 to 2 per 1,000 births. But it's also the most serious postpartum mood disorder.
Yeah, and then this one's considered a medical emergency because of the risk of suicide and infanticide. Symptoms of this can include hallucinations, delusions, confusion, and severe mood swings.
And it's definitely seen as an immediate medical intervention is required in this case. Although it's rare, but it's really critical to be able to recognize this one.
Yeah, for sure. So then kind of moving into like why this happens, the risks and the causes. One important point is that there's no single cause of postpartum depression or anxiety. It's a combination of emotional, physical, and social factors.
Particularly physiologically, after like childbirth, there's a dramatic drop of your estrogen and your progesterone hormones, and estrogen will influence your serotonin levels. So when they drop, it can really mimic depressive symptoms. But then progesterone on the other end, the fluctuations can contribute to anxiety and poor sleep. And on top of that, you have your thyroid hormone, which changes, which those changes and fluctuations can cause like lethargy and also just general fatigue.
Yeah, for sure. And then if you layer on top of that the sleep deprivation that happens when you're caring for a newborn, and then sleep deprivation alone can significantly impact mood, cognition, and emotional regulation. You can see how these all compound together.
I think it's also important to notice the risk factors associated with this, right? It includes a lot of the personal and family history of depression, anxiety, even like bipolar disorders that like your family might have had. This even considers like stressful life events such as financial strains, even infertility or complicated childbirth, even like difficulty breastfeeding after birth, or even a loss of a loved one or social isolation. These all play a major role into these conditions.
Mm-hmm. And then on top of that, research has also found that adolescent mothers and also older mothers may be at an increased risk of these mood disorders.
I definitely think that one's one that like we don't really look at anymore. And the fact that even like mothers with female partners are also one that is not considered well enough, and the fact that they may actually face increased risk of postpartum depression due to the heterosexist attitudes and the homophobia from healthcare providers that exist. Or even like family rejection that might be part of the situation. The social cultural stress that kind of exists can really significantly impact the mental health.
Yeah, for sure. And then this also connects to the heteronormative ideals of what this perfect family, or this ideal family might look like. And then this relates to how any deviation from that ideal can create like a lot of additional emotional distress for these new mothers.
I definitely agree, and it's something that's really misunderstood nowadays as well. But also we forget the fact that with like these conditions, there comes a lot of identity shifts when you have postpartum and the social cultural pressures that exist within our society. Because postpartum is not just a biological thing; it's very existential.
Absolutely. Yeah, so many women describe this tension between their identity as a woman, as a self, and then their identity as a mother. Henneken found in their study that women often feel forced into these two extremes where they're either being highly career oriented and then kind of neglecting family roles, or the other alternative is becoming completely mother oriented and then their career suffers.
Yeah, and I definitely think with nowadays with the roles switching like femininity and the fact that a lot of women are in careers, but they also find that they lack the role models that are able to successfully balance these like both the career and then like the motherhood. And so women did report being really confused and insecure and lonely within this transition. And so many described creating that kind of imagined ideal role model by combining traits of both types of women.
Yeah, and that those are really hard emotions to be going through in this identity shift on top of doing all of these things that you need to be doing with your newborn baby. There's also a lot of pressure around this expected joy that people think mothers should feel. Society tells women that this should be the happiest time of their lives, and then if they don't feel that joy, then they feel guilty and they feel like something's wrong with them if they're not feeling that way.
I definitely think that one's, something we don't talk enough about enough. But then we can't also forget the fact that there's body image, and that one's a really big one when it comes to pregnancy and postpartum, because pregnancy is often viewed as like that temporary, socially accessible state of weight gain that you can have. But postpartum, there's this expectation that you have to bounce back into your original body, and that unfortunately takes time.
Yeah, absolutely. And women also on top of that reported feeling that they felt protected from that social judgment while they were pregnant, but then they felt immense pressure to then reclaim their pre-pregnancy body right after giving birth. So this postpartum body dissatisfaction is actually really, really common.
I think it's definitely about the fact also that body image is not necessarily about the physical appearance, but it's also kind of the identity that comes with it and the psychological representation of one's body. Many women do describe feeling like their pregnancy happened to them, and it created a loss of control over their bodies, and they feel like they just couldn't control anything about the way their body image was, and that definitely affected their mental health.
Yeah, for sure. And then after that feeling of not being in control, all of a sudden there's this huge pressure to regain control in postpartum. They're supposed to regain attractiveness, they're supposed to regain their identity, and then that's all on top of caring for a newborn.
I definitely think that when we break it down into so many different levels, we understand that there's so many different pressures that come from the social, the emotional, and also nowadays with our today's generation, we have the media portrayals of motherhood, and it intensifies the discrepancy between the reality and the idealized image. And so we can definitely fuel dissatisfaction from that, and even psychological distress.
Yeah, for sure. The body image part is a super difficult emotional and psychological process to be going through. So untreated postpartum anxiety or depression can interfere also with the mother-infant bond.
I definitely think that one's not talked about in the cases, especially with anxiety, but it also it does lead to the difficulty of responding sensitively to infant cues, and it also can increase the irritability that a mother may experience, or even some level of withdrawal, and that does in fact increase the stress levels that the mother will have when their interaction with their child.
Yeah, and then that's not at all to blame mothers. It's about recognizing that the mental health directly influences relational health with their baby.
I definitely think there's very much of a gap with the studies with that. And speaking of gaps, actually, we will talk about the screening gaps and the disparities that we experience now in today's generation. So we have measured organizations which include Associations of Women's Health, with the obstetric and neonatal nurses, the American College of Obstetricians and Gynecologists, and many more. They definitely recommend screening all pregnant and postpartum women.
Yeah, but then there are gaps, right? Because this typical 6-week postpartum visit may be too late for high-risk mothers.
And I definitely think the comparison between having, those bi-weekly or the multiple assessments that they have prior to the pregnancy or the childbirth, and then that just one assessment following childbirth. But we can't also forget the racial disparities that exist in today's world. The fact that the treatment initiation rates are particularly low for Black women at 4%, Latina women at 5% compared to the 9% of white women. And then among those who initiate the treatment, Black and Latina women are less likely to receive the follow-up care compared to white women.
Wow, that's a very important statistic, I think. And then suboptimal treatment was also prevalent among all low-income women, but the racial and ethnic disparities are particularly concerning, and they require policy-level attention and changes, I think.
I definitely think it's so important to keep talking about these things, but also to learn when to seek help with treatment. And so if baby blues, like we talked at the beginning, they persist beyond that 2-week mark, It's very important to have an evaluation of postpartum mood disorders, and it's really recommended to go get them checked out.
Yeah, for sure. And then for treatment, it typically involves psychotherapy, antidepressants, and sometimes mood stabilizers. But then some medications can also impact breastfeeding, and you may be recommended to stop breastfeeding if you're on a certain medication.
I definitely think, these are so different cases, especially because some people might have restrictions to breastfeeding as well. But interestingly, prolactin, which remains elevated in like breastfeeding women, it has a calming effect for them. And some evidence even suggests that breastfeeding may offer partial protections against PPD.
Yeah, that is super interesting. But then we also have to be careful with that, not to stigmatize formula feeding mothers, because the decision to breastfeed is super complex and it's deeply personal.
I definitely agree. And so, to kind of close this up, what can we take away from this?
Yeah, I think postpartum mental health is not a weakness, it's not a failure, and it's not a lack of gratitude.
It's definitely a biopsychosocial experience. It's shaped by your hormones, sleep, your identity shift, your cultural expectations, the pressures, supporting system, and even the structural inequities.
Yeah, and so if 1 in 5 women experience postpartum mood disorders, then this is not rare, it's really common. And that means that it deserves attention, it deserves screening, and it also deserves compassion from surrounding people.
And maybe even most important, the mothers deserve the support not just in keeping their child healthy, but also in staying mentally well with themselves.
Yeah, absolutely, because caring for mothers is also caring for families.
Thank you so much for listening to today's 4th Trimester podcast.